What is Plica syndrome? What are the signs and symptoms that can tell you that's the injury you have in your knee? And what current treatments are available to help you recover from it? We discuss all of that in this video. My name is Dr. David Geier, orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Now, Plica syndrome is one of these diagnoses of the knee that used to be made a lot, especially if you go back to the 90s, maybe the early 2000s, in the advent of arthroscopic surgery, or certainly when that surgery ramped up. I don't expect that it's nearly as common as it used to be diagnosed, and you don't hear much about surgery for that as much as there used to be. Basically, a plica is a band of tissue in your knee that sort of connects the joint to the overlying skin, and it's usually found in various parts of your knees. We tend to have a lot of them when we're very, very young, and then they gradually resorb. But in some, especially adults, it can persist and sometimes actually get thickened with repetitive activity and become a source of pain. The most common one, and again, we don't have the overlying skin and soft tissue, but would be one that sort of connects the inner upper part of the knee with the overlying skin. And then as your knee sort of goes through a range of motion with sports or exercise, something like that, and again, it's usually repetitive aggravation of that tissue, it gets inflamed and then it becomes a source of pain. Now, as far as there's, the nature of it, it's not doing any damage in the knee. It's not causing further damage to bone, cartilage, tendons, and ligaments. It's just pain. But if you're somebody that does a lot of repetitive jumping, depending on your sport, or a lot of repetitive running, or with a repetitive knee motion like cycling, that could be really, really aggravating. Some of the sort of the conventional things we do are things like physical therapy to try to strengthen the muscles around the knee to take pressure off that area. Occasionally, an orthopedic surgeon might inject a little bit of cortisone, which is an anti-inflammatory, into the plica itself, not necessarily throughout the knee, but try to get it into the plica itself to kind of calm that down. Sometimes people will try anti-inflammatory medications like ibuprofen or naproxen to see if that helps get it better. Very rarely, if nothing gets it better, a surgeon will go in, scope the knee, and basically use a shaver and take that plica out. And that can be effective if that's the source of your pain. It's a tricky thing to diagnose because, one, sometimes you can feel it on MRI if it's really, on physical exam if it's really thickened, but a lot of times you can't. And on an MRI, yes, you may see a plica, but you don't know that's the source of pain necessarily. And again, a lot of people have plicas in their knee and they don't have pain, and that's where it gets really tricky. And so it becomes a lot of times a diagnosis of exclusion, where you get an MRI, you make sure there's not a meniscus tear, there's not cartilage damage in that area of the knee that would potentially explain the pain. And then again, if nothing's working, rest, physical therapy, maybe cortisone shots or something like that, it's not getting you there. That's where arthroscopic surgery and debridement of the plica sometimes can be helpful. As far as some of the current treatments out there, I don't expect that there would be any regenerative treatment that would make a big difference. Again, it's more about inflammation of that tissue, but maybe something like penisin polysulfate, which is very good at stopping inflammation and inflammatory cytokines in the body, things like interleukin-1 beta, interleukin-6, tumor necrosis factor alpha. That potentially could be something helpful. I've recorded whole videos on penisin polysulfate you can find on my video channel. And in that, I talk about how that's a treatment that is FDA approved, but just not for orthopedics. So it would have to be used off label, not promoting it. I'm just saying that's something potentially that you could use. Now, I'd love to hear about your experience with your knee injury. Leave those in the comments below. Just understand I can't offer you medical advice, but I will try to answer your question in a future video. Make sure to subscribe to my video channel. Click the bell to be notified when I release a new video or start another live stream like my Ask Dr. Geier live shows. Now, if you have knee, hip, shoulder, or some other joint pain, and you want to get significantly better in the next 30 days without cortisone shots, without physical therapy or surgery, you can learn more about working with me in the description below this video. Thank you so much for watching. I look forward to helping you feel, look, and perform better than ever.